Okay, so we're live. This is Senate Health and Welfare. We're back. We're going to be looking at S-151 with Jen and then be celebrating Recovery Day with some folks in a little bit. But I wanted to share with you that Jen is going to be presenting the S-151 with the sections taken out that we had looked at previously, and then the 151 bill, we can go through and see what's left. One of the issues that we need to deal with within the bill is our all payer model and the next steps for that. And the next steps for that is work that's going on between the administration and the federal government, and the new, it's called a model, but it's more like a program, is ahead that we have looked at in here. And so understanding what are the things that we can do legislatively to help and to encourage that application to the federal government is part of the ahead model. So I've been working with others outside of committee to try to understand, working with the administration, Green Mountain Care Board, the healthcare advocate, and the hospitals to understand, insurance companies, to understand what we can put in legislation that will be A, agreeable to all parties, and B, will help us move forward with the ahead model. And so once we have something that is agreeable, we can ask for those folks to come in and testify. And we can look at the information that will go into 151 and make our own policy choices here as a committee. Of that, I just want to share that with you about S-151. We'll also be taking testimony. Most likely we'll start some testimony next week on the bill. And so folks who have asked to testify will be able to do that beginning then. So I know there are a lot of people who have been sending notes to Kiki, and some of them very inappropriate, I must say, that it is our responsibility to put testimony up that's pro and con, but we do not accept negative comments to our staff or to our senators around the table. It's our responsibility to have that testimony posted and to allow for folks to speak. So I'm saying that publicly because I feel that there's a misunderstanding in the public about what our job is here, and that the responsibility that we have is very real, but we are not dictated to by any individual or organization in the building or outside of the building. So there, I've said my comment, and now we can turn to Jen.
Good morning, Jennifer Carby, Office Legislative Counsel. So I do have a new draft, as the chair said, of S-151. It is just taking out the pieces that have already been enacted, and in one case, I combined the two different pieces around minor consent into one section, one of which just points to the existing statute on consent to treatment. So, so in the draft itself, I put in little notes about what the former section was. I think what I will start with is just showing you the crosswalk. They're both posted. I was checking that out. So I just called this a renumbered sections crosswalk. Gave you what the topic was. So I used S-151 as introduced as the base document of what the section numbers were there. And then I told you where to find it. The main reason that I reorganized things is just that I was having trouble finding all of the various pieces. There didn't seem to be a particular coherence to how they went together. So I put them in numerical order by title, title of the VSA. So starting with Title 8 and ending with Title 33. And then the section on one or two sections that were just session law don't get codified. Those often go toward the end. So that's the rhyme or reason behind new ordering. I thought that would be a useful reference document. And then I will put up So. And so this is done as a strike all, but this is the preliminary draft. It doesn't mean you made a decision about what's in or out. It's just a way to put the language together. And so you can see throughout, as I've renumbered it, I just said what section it was so that you can find it. And any other changes I indicated in highlight as well. So you can see I didn't make any changes to what is now section 1. When the bill is introduced, that is on some additional information to be provided with health insurance rate filings. Didn't make any changes to what was section 2, which changes the coverage requirement or modifies the coverage requirement for colorectal cancer screening. Section 3 was section 16 is the insurer participation in multi-payer alternative payment models. Section 4 was section 7. I did make, as I said, I kind of combined those two provisions. And this is the consent to preventive services and treatment by minors for treatment of a sexually transmitted infection. And I, instead of having 2 new sections of law, this is all going in the chapter in statute on sexually transmitted infections. I just kind of used the language from 18 VSA 4226 and said a minor 12 years of age or older who has or is suspected to have a sexually transmitted infection may consent to treatment in accordance with the provisions of, go see that other place in statute where it already lives.
So can you, this is a section that has been a lightning rod for many people.
Okay.
Can you describe for us those things that are, what here, if anything, is current statute?
Yeah, so what is highlighted in bold on page 4 is a description of what is current statute. It is in 18 VSA 4226. So that's why it's referring to that section. So this piece is just recognizing that there is already the existing authority under 18 VSA 4226 for a minor, and I believe it says who is suspected to have a sexually transmitted infection. So I said who has or suspected to have, because it's unclear who is doing the suspecting, may consent to treatment in accordance with the provisions of that existing statute.
And we did, and because it is such the section that's in the bill that's new, because that was a concern to so many people, we did hear some initial testimony on that one section from our adolescent medicine expert. We will, obviously, when people testify on the bill, circle back on this.
Right.
All of it.
Right, so the provision that would be new to the law would be the prevention piece. The treatment would be just pointing to the existing section. And then we talked about the conforming revision. And I thought it was excessive to be directing my office to replace venereal disease with sexually transmitted infection. I thought we could just do it in the bill. When I searched it, there are a lot of instances of venereal disease terminology in the statute. So happy to do the changes, but I thought it might create more confusion if you had many pages of statutes all about sexually transmitted infections. So, so we can do this here, or we can do this even in next year's technical corrections bill, just to update the terminology. Section 6 is the annual reporting. In this case, just adding the requirement that insurers include with their annual reporting their risk-based capital report. So move this up to section 6 instead of 13, but did not make any other changes. Section 7 was section 4 is the increase in primary care spending allocations to at least 12%. Again, no changes there. Although you may want to, if you keep this provision in, you may want to look at whether you want this to be December 24 to 29, or if you want to change those years. Section 8, I combined 2 sections because they were both in 18 VSA chapter 220, which is the Green Line Care Board chapter. So this section 9372 was a standalone section. I included it in here before opening up the whole chapter. And that has to do with some changes to the duties of the board, the scope of the board's authority, a little more sort of descriptive than giving authority in that section. 9374 and 9391 had to do with the Green Mountain Care Board nomination and appointment process, and we've looked at that. We haven't made any changes to the content. Section 9 was section 14. This is the language on the Green Mountain Care Board budget review and some particular requirements for the board's establishment of budgets. If you continue with S211, which would change the timing, you may want to make sure you're consistent with the timing for the hospital budgets, which that bill would move this first date to June 15th and the second date to July 1st of line 14. Section 10 was section 5 is the requirement that the workers' compensation rate schedules be updated at least biennially. Didn't make any changes there. Section 11, which was section 3, is the Medicaid budget provisions requiring, they were expressing legislative intent that there be reimbursement for Medicaid participating providers at rates equal to 100% of the Medicare rates. And you may want to take a look at this one, particularly given what may be coming to you from the House. You may not want to lock in 100% of Medicare.
Might lock in higher.
Right, they're currently working on a draft that would have some look at different levels based on Medicare rates. And then if you did want to keep some version of this in, I also wasn't sure on page 13 if you would want to keep that linkage to the rates in effect for calendar year 2022. So that's what that is there for. Section 12 was section 1. This is the requirement that the Green Mountain Care Board collect and review some healthcare contracts and fee schedules between insurers and providers and develop a methodology for increasing transparency around healthcare contracts. I did move the date out because this one said January 15th, 2024. I moved it up to 2025, at least to start our conversation. And that's why that is highlighted. And then finally, I moved the effective date from July 1st, 23 to July 1st, 24. Of course, that can change as well.
So there's a lot in here. Some of it, as you pointed out, at least the going to the Medicare rates are 100% or over is something that the House is considering, and it's also a bill that we have on our wall. I think they're acting on it, so they'll come to us. So we may want to. I'll have a little chat with the chair in the House. See whether that needs to stay in or whether how it is modified.
Great.
Yeah, we can do that. Is there anything else in here that, obviously the bill's been around for a while, so some of the stuff might be discussed elsewhere, but here.
Not specifically, there's nothing that I'm, I think I've pointed out the places where I think there is a little overlap happening. I mean, I didn't specifically mention it, but in the Green Mountain Care Board provisions on what is now page 7, in S211, there's also some proposed changes to that same section, the 18 base A 9372, on the purpose and intent of the board.
Okay.
But other than that, I don't think there is.
Right, and the Green Mountain Care Board nominating process, I think will be important to the nominating committee. I hope it still is. It was based on some of the recommendations that came out of that committee a couple of years ago. When you post a bill last year, it reflects what happened the year before. Okay, questions committee for Jen about what this is. So now I think we need to get used to what's here a little bit. And so I will be, when Senator Weeks and I sit down with agenda planning, we'll make sure we can get some testimony on this. I'll also be asking for any language that we get that we have on the ahead model or changes to this we'll have to look at, welcome that discussion. Be putting that up.
Just have a typo in the crosswalk styles.
Did you want to go through anything more on the crosswalk? Senator Ruick has a question.
I just wanted to thank you for this. This is This is really helpful. I like the new organization. Can I ask you a couple questions, Sharon? Yeah, I'm just curious how we're gonna move forward with this, and also I am on the nominating committee for the Green Mountain Care Board, so I'm wondering, will we be informed, or will we have a say at all? And
So we'll invite the chair of the board in to testify, and there may be others, if I can find the previous chair who was very instrumental in making some recommendations, we'll bring her in. So, but yeah, the nominating board is critical to this, as is the administration involved. And then, as I said before, we'll be asking, we'll be putting testimony up on the agenda and look at the There may be there are sections here that might change radically or disappear. There might be other sections that we decide are more important. So it's all there for our decision.
Yeah, I mean, there's a lot in the bill.
There's a lot here.
And I have concerns, I'm sure you know, on several of the
Yeah,
sections.
well, that's the point of taking testimony, and we'll have a discussion. There's something in here there's things that I would like to see in here, including equitable reimbursements for providers, whether they're hospitals or physical therapists or anyone else. So maybe that's something I think we need to consider, because we've had so much discussion about that. So, yeah, we'll see where we get and what we can get. You know, the bill may be much shorter. It may look quite different when it's finished. Useful. Any other questions from the committee? I know there are a lot of questions around the room. I can see them all, and I'm glad you're here for this conversation, because now as we set our agendas, you know, the things that we're asking you to speak to, including going forward on the AHEAD model, which is not totally reflected here, but there are some very important issues for us in terms of healthcare, and each of you is involved in different ways, so I appreciate that you'll be engaged with it. Hopefully. That's it. Any other questions? I never know how much time things are gonna take. I thought, 192 might be over sooner, and then I thought 151 might take longer. I was anticipating having some testimony today, but 192 is really preoccupied us, so we can't do that. We can do that. So we're gonna take another quick break, and we have folks coming in from the recovery day. And this will be in anticipation of S-186, where we're gonna be taking up the recovery center bill tomorrow morning.